All right. So welcome everyone to our monthly call of the Vermont Association of Senior Centers and Meal Providers with our partners and colleagues from Dale and our AAA representatives. Thank you for being here or watching the recording later. I'm Deanna Jones, and I'm one of your co-chairs of the Vermont Association of Senior Centers and Meal Providers, or VASCAMP. So welcome to the new folks or those who are sitting in for some of the regulars as well. It's good to see you all. I think our primary agenda for today is to do a check-in and get any questions and answers answered, hopefully, or discussed. Any updates from Dale or the AAAs, and specifically any questions surrounding the meal cost worksheets that are due back to our AAA so that we have that statewide meal cost analysis together. So does that seem like the appropriate agenda to everyone? All right. Let's turn first. Connor, would you like to do any sort of an update first, or is it helpful for you to hear the roundtable sort of check-in first?
I can just start with saying that the Senior Center survey, the final results and the narrative report putting together is mostly finalized. I asked the VASCAMP steering committee to give it a final review and provide any feedback. And I've gotten some great feedback so far that I'll incorporate. And notwithstanding, any unforeseen things, I'll have that out to everybody in its final state this Friday. So keep an eye out for that. And hopefully it'll be not only helpful to you, but informative. And if you have any questions about it for further detail, further information or context, feel free to email me and I'd be happy to go over with you in any amount of detail. And so with that, Deanna, if, after we do round robin and discussions, if there's anything else that you want me to address or that comes up, I'm happy to jump in. I see, Kathy, you've got your hand up.
Connor, will you be sharing that with the AAAs as well?
Yeah, absolutely. Yep.
Thank you.
How do you distribute that, Connor? I know you'll send it out to all the senior centers and AAAs, but does it go further than that? Does it go to the commissioner or to where else does it go?
I can share it internally, certainly. Yeah, no, it's something that the Dale team would be interested in. So yeah, once I share it out with you guys, I will certainly share it internally. And then from there, if it's something that you want posted on your websites, or we could post it on the Dale website under reports, that would be appropriate. So I'll look to you guys for some input on that, and if you think that would be best, then we'll go that route.
Thank you. There are, just for anyone who's not familiar with it or hasn't been part of it before, there are two previous reports, 2018 and 2019. We skipped 2020 because of everything being so busy with COVID, but those historical reports are on the Dale website as well from these survey results. Thank you. I'm excited for everybody to get that. And again, appreciate everyone who responded to that survey in the first place. All right, good. How about any updates from either any of our AAA representatives that are on, or Mary Hayden from V4A, if there's anything you'd like to share?
Well, I have a question, something that we're considering as we're cleaning up the Dropbox and the way we communicate with the meal sites. Is everybody still using not the bill and the breakdown? Because it seems like the breakdown is just an exercise in futility and not really necessary information for the AAA. And I'm still relatively new, so I'm just kind of trying to feel that out. Does everybody know what I'm talking about? Oh, okay. Well, it's a sheet that it breaks down the clients into the different counts, congregate and home delivered. It has VCIL, it has the donations that were made. It's, you know, and our meal sites use that to populate the invoice that they put in the Dropbox for us. So no one else uses this.
We're using it from
So
Mango.
I got my.
I think that's
Oh.
a regional form that's used in your service area, but not, I mean, we have our own. We call it a meals donation report form, but as, you know, each AAA completes their information differently with
Okay.
their providers.
Also, the breakdown form has donations and what monies are coming in. I don't know if the council wants that data or not.
Well, in the contracts, the monies that are collected in donations go to the nonprofits, the individual meal sites. So we don't necessarily have to track that. So I'm thinking that's a form that we may be able to.
It actually shows you a picture of what's going on. We do collect it and we do see a picture of what's going on. It's also an opportunity for training. So.
Okay, so
Yeah,
let's
and
just
Will,
say then
Herb, I think that it's something that you would want to talk to your meal sites in your Northeast Kingdom section as to what you know, works for you and them.
Yes.
okay.
Maybe we don't send it to the council, but maybe we keep it at the.
That's what I'm thinking.
I don't know.
It's also on the meal cost analysis that we're just doing. It's on that form also that we'll be submitting for the whole entire year. But we do report that number as well.
Yeah,
It's
and
a different
just to
form.
give some context, and for you, or specifically since you're newer, what happens is these funds that you have, the funds that are used to establish the contract come from the federal government for the Administration for Community Living. And they go down to the area agencies on aging. So those meal rates that you have set, that you receive, are federal dollars, basically. And part of the reporting that's collected from the federal agency is the voluntary donations to the meals. So what the Council on Aging does, or Northeast Kingdom Council on Aging does, is they then aggregate all of the donated money, or the funds that were used to help support the cost of the meal, and then they report that back to the federal agency. And what that does is it allows the federal agency to then again sort of aggregate and report back on what is the contributions being made towards these costs of meals and in total. So as you think about how these programs are supported, you know, it's kind of a balance of federal, state, local money, and then the contributions. So that is, those are dollar amounts that get aggregated and reported to the federal agency, just for your.
Oh, sure. And that information could still be extrapolated from the meal cost analysis is what I'm saying, rather than, you know, the meal sites by all means should be tracking their donations.
Mhm.
But, you know, I could still get that information from the meal cost analysis in aggregate, like you're saying.
Then that's a great point. This is only the second year we've done the meal cost analysis. Before that, there was never any statewide sort of compilation of those meal cost analysis. There wasn't a worksheet like that done where we were asked for our meal cost and calculated it out that way. So we were only reporting it on a monthly basis through the type of form that you mentioned, even though it's different for each region. But now we have this wonderful big worksheet that we reported all for the whole year, and everyone's doing it, calculating their meal costs the same way.
Okay.
Well,
So I'm going to say, you know, the jury's still out on that one. We're probably going to redesign the form and just make it less of a redundant activity. So now on to the meal cost analysis, right?
No, I appreciate any reevaluating what you're currently doing and avoiding redundancy is a noble goal. Mark has his hand raised.
Yeah, the form was a lot, I thought it was definitely more refined than last year. I still wonder, there's still a lot of discretion in there. So I'm not sure that we're all exactly calculating the same way. So I'm wondering maybe for next year, there's a little bit more clarification. The definition sheet that came with it didn't really apply to most of what was on the worksheet. So it might be nice just to go line by line and say, these are the kinds of allocation methods you can use. These are the kinds we don't want you to use. For example, for town funding, presumably when we're talking about the cost of meals, and you're asking for revenue figures, I wasn't sure if we should allocate those based on funds that are used for the nutrition program. For example, we get money from the town and it's like, do you want all of the money that includes facility management, programming for seniors and all kinds of overhead, or just an amount that corresponds to the nutrition program? So I did detail that out in my sheet, but I can see where some people may put an allocation for the nutrition program versus just a lump sum for everything, at least for those of us who do more than just provide meals.
Right.
Good point, Mark. It really is for the nutrition program. So yes, to answer your question, you would want to separate that out.
So I think I agree. That was an area last year and this year where I think we looked at what our total budget was and what percentage of that was related to nutrition. And then we took the same percentage. So if our nutrition budget was 70% of our total budget or 60%, then we took that percentage we use that same percentage on expenses like insurance or income like town funding and use the same percentage. Is that correct? I mean, is that an appropriate way to do it?
Yes. I'm speaking for everyone. Yes. Connie,
Yeah,
you can speak for that.
Yeah, I think just maybe for next year, just literally going line by line and saying these are the allocation methods that you should use. For us, it's pretty straightforward because we get a statement of functional expenses from our CPA once a year. So we have sort of a rough percentage that we can use, but there are other ones like rent where we use square footage, and other utilities where it's a little, like I said, there's discretion involved, and it would be nice to know what the limits of that discretion would be, just to try to keep everyone within the same ballpark. So
Right.
Can we have that discussion like shortly, like after we submit this, and then look at, I mean, not to have it just, at the end of the year.
Are you talking, Kathy, about the AAA directors having that discussion or all of us together?
No, I want your input. I want to know your input
Yeah.
on that, and how we can help you. We've done financial sheets in Central Vermont for years, 25, 30 years. And this is different for us. And I would like to get it down to the nitty gritty to make sure it shows the picture. And nothing better than to ask people who are doing the books what you
Right.
see, what is your input for them?
Kathy, I'd be happy to be part of that. I have like a really sick fascination talking about bookkeeping and accounting. So
Excellent.
It's a good trait to have.
I don't know. Depends on who you ask.
I love Excel, and I used to love Lotus before I loved Excel. So if that tells you anything about my personality.
Deanna, for Halloween one year, I was an Excel spreadsheet, so I can relate to that.
Oh my gosh, that is too far.
I'll email you some pictures.
Yeah. So I think the meal cost analysis worksheet is due, at least for our region, is due tomorrow. So I haven't done mine yet. Have other people? I mean, I have all the data. Our bookkeeper got it all together for me and I have to figure out the percentages and I'll have it to you tomorrow, Wendy. But I wonder if there's anyone else on this call, or if there is anyone on this call who hasn't done it that still is looking for support this year in doing it. Or is everyone comfortable with it and ready to send it in or has sent it in? Kathy?
Well,
I just have a
go ahead.
question of, oh, sorry.
No,
Me?
go ahead.
I just have a question about, we got a grant from the United Way, and it was for immediate and critical needs. And so there's a slot on the income for United Way. So does the $1,000 go there, or does it go below in-kind expenses under something else? I'm confused about that.
Did you use it for your nutrition program?
Not exactly sure what it got used for.
I would say you only include it if you used it for a nutrition, specifically for the nutrition program, or if you
Or
used
equipment.
a portion of it. Yep, or equipment. Yep. I would
Okay,
include it in the top as income.
so if grants don't say particularly, or one I think we applied for from the food bank, and it was for, or somewhere, it was for food trays. It was for all of our food trays particularly. So that's obviously equipment. So that would be under the equipment expense thing in kind. Right?
Kathy, for typically on in-kind refers only to gifts of actual goods, not to money that you use to purchase goods. So you would put that under the income section somewhere, and then any expenses you would list out on the expenses. So in-kind would just be donations of time or non-financial contributions.
So all the financial grants we got, whether they were for food or trays or whatever, goes into the income.
That's
Okay.
that's the way that we did it. Yeah.
Okay.
Yeah, and
Okay.
any grants or stuff that didn't fit into the other categories there, we just put into other. And if they were unrestricted, and then we used we said roughly 50% of our budget goes to the nutrition program. So
Gotcha.
we applied that percentage to any unrestricted funds that may have been used for other stuff.
Thanks.
What about in this past years being so different with COVID? And I'm just looking at the worksheet because I don't know the answer and maybe it's right in front of me, but we like the Bernie mitten grants, those kind of things that were really special income that were related to improving our nutrition program, but really ended up being capital improvements. Do those have any place on that this year, or is this strictly operational, not capital related for income and expense, like equipment? Some of it might be equipment on this. What's your feeling about this?
I think it should be included if you've used it for your meal program. I mean, if you used it for the senior center, then I wouldn't include it. But if you used it for your meal program, yes. And the way I'm kind of looking at it is it's not going to, including that isn't going to affect the meal cost at all. So we can always back out that information if we need to later. So it's pretty easy to identify.
So, I mean, in a normal year, we would have some equipment costs, obviously, but this year, when we got the Bernie grant, we bought a new cooler. And so we might have, 4,000 for income and 4,000 for equipment expense that we wouldn't normally have in a normal year. But that equipment in there will affect the per meal cost.
Yep, I see what you're saying. Yeah.
Yeah, I guess that was a question I had. We did not have any significant equipment expenses this year, but I was thinking in future years for items that are capitalized on our financial statements instead of expensed. I think we use the IRS limit is like $2,000. Is that something like, would we still include capitalized equipment purchases on the meal cost sheet, or because I remember last year there was a depreciation line, which is typically where you would see those expensed over time. But this year it just says equipment. So like if we buy, we're probably going to be buying a new oven this year. And the expense is enough that we're not going to report it as an expense. It's going to go, it's going to be capitalized and added to depreciation over time. So what would we do in that instance? See, I told you I have sick fascination with this stuff.
So I feel like these are questions we should write down, and then we should talk with the accountant that helped us design the form so that we can get, accurate answers for you.
Thank you. I think it could really skew one center's numbers differently than another's if we're including capital in that way.
I'm confused again. Sorry, I'm confused again. I thought we just said that grants are money and money goes to income under grants. And now the grant doesn't go into income, it goes into the expense category of something.
Well, you spent it on
We-
something. So a grant is an income, it's dollars in. So you spent it. I mean, it's a
Right.
revenue, right? It's a dollar revenue. So that's why you put it
Yes.
as an income. And then you
Yes.
expend it. You're going to use it for something. So that's the bottom part is the expenses.
Ah,
So the
gotcha.
expenses is where you explain what you use that money for.
I
It
say,
doesn't-
so all the grants get divided up in the expense section somehow.
Correct.
Okay.
So I think this was already very helpful for me, having not started filling out the form yet. But if anyone has any specific questions, is it the best thing to do to have them contact their specific AAA nutrition director when they're finalizing or filling out their report? Okay. All right. That sounds good.
And I've been asking people, Cynthia had some really good questions as well, to just list those in an email to me so that we can make sure when we're kind of debriefing this later that we don't forget those important things.
Great. I think we did have maybe one or two new folks join, and I just want to make sure they put their name and where they're from in the chat, so we have that for attendance. And then I think it'd be a good time to do our check-in, and we haven't in a few months because we've had topics to cover. But let's do sort of a roundtable and have people check in with how they're doing, any great successes or concerns that you want to share. Do you want to just do popcorn and people jump in where they'd like to?
I think you should call on people, Deanna. It puts us on the spot. No, put
Okay,
that.
then I'll get everybody to join in. So let's see, Nicole, I love picking on Nicole. She has such great ideas, and she's looked into some cost sharing and group purchasing ideas for us. So let me start with Nicole. If she's there, how's it going, and what's new with you?
Hi, Deanna. Thanks for calling me out first. Everything is good. We're full staff, which I don't want to brag about or be too get too excited about, but yeah, things are good. We've been in our new space for a year. Feels great to have a chef on board. It was fun. We did the World Guinness Book World Record of bingo, as you guys did. Thanks for sending that my way. That was a lot of fun. We had some people at the center playing. We played this through a place, what would you call it, Televeda. They're kind of work with different insurance companies, and their goal is to, squash social isolation. And somebody from our center actually won the bingo. So that was pretty cool. I did just finish the financial sheet after talking. Now I'm nervous that they didn't do it right. So Kathy will let me know about that. And so for trays, I unfortunately don't have an update. I heard that things were looking good, that they're still working on it. And all the questions that you guys asked me, like especially about the equipment lease so they were supposed to be getting answers on that and getting back to me. I couldn't really give them a good answer of how much Oliver trays that you all use, just because I didn't get a lot of feedback on that, unfortunately. And that's really a big selling point for them to be able to get that contract. So I know that they're still in talks, and hopefully they'll, get answers to questions sooner than later. But it's nice that just to know somebody's working on it. So we would have to purchase the trays through Reinhardt Food Service. And there is minimum deliveries. I do know that requirements. But obviously I said nobody would do that if we had to let go our equipment. So keep that in mind when you're negotiating. But yeah, everything's going good.
Good. So for anyone that doesn't know, that's related to the possibility of group purchasing for our trays and getting a better rate on our trays through Reinhardt. But we'll keep people posted on that, or Nicole will, and as progress is made. Thank you, Nicole, and congratulations on the bingo win. So that was pretty exciting that somebody from Vermont won. I think there were 700 and some sites all around the country and a few in different countries on this one online platform for bingo. And my people were getting very restless because it was so slow. They said they must not know any real bingo players because this is way too slow. And then someone from Nicole's place won. We were so happy. So we were part of a world record. Laura, what's that?
They were playing virtually too. They weren't actually at the center. So we had no idea until we heard it announced because they were playing virtually.
Cool. Very cool. How about Lori down in Springfield? How are things with you, Lori?
They're going good. We're having our activities. We're getting ready. We're not having our normal holiday bazaar because it's just, we voted against that. But what we're doing is members that sell items, craft items in the bazaar, we're having a craft sale. So it'll be no food. It'll just be members selling their crafts. We're going to have it on a Wednesday instead of a Saturday. So it'll be low, scaled down some, but we're excited about that. We're also getting ready to do our trip ballots for next year. We're going to plan on, hopefully we can get out and do some trips next year. So we're going to vote on that. And we have a lot of our activities. We just don't have large events going on right now. But we have people in and out all day long, our exercise, ceramics, shuffleboard, cards. So it's good. It's nice to have people back.
Good. How about Melinda up in the Northeast Kingdom?
Hi. Before I give my update, one quick question about the group purchasing is for the trays. Is that Oliver trays or is that it's the Oliver trays? Okay. Because we don't use the Oliver trays, we use the aluminum trays. The last time I priced it out that they were both about the same price. And we just felt that it was easier to use the aluminum trays, but if we do get better pricing, then I'd consider switching over. But how are things going in our community right now, unfortunately has a lot of COVID cases in it. So I just had to shut down the congregate meal site again yesterday. We're still doing the Meals on Wheels, obviously, and so that increases our Meals on Wheels a little bit. Yeah, actually my cook has COVID, so that leaves me cooking. which is not my favorite thing to do. But we'll get through it, and you know, I expect that things will start to calm down shortly. As far as activities, I definitely, I would like to hear more, not necessarily in this meeting, but like through future meetings or even through email exchange of how the different meal sites get funding for to provide these activities, and to, like, everybody has activity directors and has like full staff. We're a very small site, and I'm just, you know, wondering what we can do to sort of, you know, to get some help to actually be able to hire somebody maybe part-time to do activities. And I definitely, even when I try to put the activities together, I don't know if it's the age group that we have, but I do have a lot of very elderly people right now. And I'm trying to bring in some younger elders. But we have a hard time with participation. So that's a real struggle for us. So always looking for ideas on that. So basically funding for activities person and participation levels. That's what I'm struggling with.
Yeah, those are both big questions, and I will be interested to hear what anyone else has to say too. It reminds me of, I just emailed Connor and Jana, my co-chair of the VASCAMP here, about AmeriCorps grant opportunity that just came up, and an AmeriCorps grant for a site that doesn't already have an active AmeriCorps grant might be a way to have some grant funding for a position. And I'll forward that to you, but it was Jana and Connor's recommendation that I share it with Mary Hayden at V4A and the AAA director group to see if it was something we could work together on, because it's a pretty intensive application for that particular grant, but it is something that centers could get staffing potentially, you know, have a body, you know, person with that. So that would be one thing. And then my only suggestion related to programming and successes is, you know, emailing our group or getting on each other's mailing lists for newsletters or following each other on Facebook. I think those are, you know, sometimes ways to get program ideas for what works or what is working in different places. I'd suggest those things. Any other feedback?
Well, Melinda, have you talked to Karen Buddha at all at the council here?
Yeah, I do. I'm in touch with Karen. Yes.
Okay.
Yeah.
Well, next time I see her, I'll mention your desire to
Yeah.
have some activities, and maybe
Right.
we can
Yeah.
follow up on that.
Just for example, I mean, I know Tai Chi, I've tried Tai Chi in my area a couple times, and that's just like that. I can't get people interested in that. I've had it all set up for the springtime, and we had, you know, the first time we had like 5 participants, which is, you know, was successful for our area. And by the 3rd round, we had 1 participant. So.
Well, we'll try to get something that's not as I don't know, active. I don't know if that's, you know,
Or
I know
less
she-
active. I feel like my feedback is that, you know, it's too slow.
Oh, too slow.
Oh.
Oh, well, then heck, we'll get something a little more active. All right. Well, I'll work on that and pass that information along.
Yeah.
Yeah.
Okay. Thank you.
Food is always a way we pull people in too.
Yeah, we used to do potlucks, and then we'd have like an activity, and that worked. But with COVID, we're not, you know, doing potlucks and right now, and don't really picture it anytime soon. That's something we usually normally do in the winter, combine that with an activity. But
Yeah.
COVID obviously has a lot to do with everything that's going on right now as well.
Yeah. Damn.
Over
COVID.
in New Hampshire, we were doing culinary classes. I know you love to cook, obviously, as you've stated. You know, if you could get some of your your clients, your people there to do a little, not cooking competition, but some cooking demonstrations, and just that's good camaraderie
Yeah.
and a nice activity.
Along those lines, we had the dietitian and we're in Senior Solutions area. We asked the dietitian to do some cooking programs that also were nutrition education. But for Valentine's Day, we did like a chocolate themed one, and she brought in dark chocolate and talked about the health benefits and that kind of thing. And we had to buy the ingredients, but she did the teaching and the cooking. And then I think we've done a couple of different ones like that with her that were really, because they got to taste, and it was kind of how we promoted it. Those were fun, educational and food related.
Yeah, over in Colebrook, they did the senior prom.
Oh,
I don't know.
I really want to do one of, I think that would be a really, really fun thing to do. Yeah.
So let's see here. Amanda is, I think, a first time person to join us from down in Windsor, Heartland, and at Volunteers in Action. Amanda, do you want to introduce yourself and tell us how you're doing?
Hi, Amanda Smith with Volunteers in Action. It's been wonderful listening and learning from all of you. Wendy connected me with this group. I help coordinate the Meals on Wheels out of Windsor, Vermont. We serve Heartland, Windsor, West Windsor, Reading, Weathersfield, and it is sometimes challenging for us for drivers, but we're doing pretty well right now, and coordinating with the Everyone Eats program actually as well to get extra meals for snow days and just planning ahead in that way. But right now we're not doing any congregate meals. We're taking that note from the hospital. They're still concerned with the Delta variant and keeping people safe. So we do provide transportation through VIA as well, but relating to meals, we are providing the Meals on Wheels.
Thanks. Nice to meet you, Amanda. Good. How about Cynthia down in Brattleboro, right? Okay. Would you like to share an update? Oh, she's joining by chat because I see that now. She can't get her microphone to work. Okay, we'll watch in the chat, but everything is good here. Good. Glad to hear it. How about Kathleen?
Oh, okay, good. My video is on. Sorry, I was having trouble with the video. So I'm Kathy Templin, and I represent the Community Senior Center in Richmond, Bolton, and Huntington. And we are not a meal site, but plenty of us deliver Meals on Wheels, but we are not doing any food in person. I mean, as far as like coffee hour and all right now, but we are having, our vision is to have boundless opportunities for the people in our communities and to be able to live life to the fullest. So weekly, and these are, and everything is on a volunteer basis. So we have a Spanish and French class, bone builders, just a great variety of programs. We have a newsletter that goes out to all of our, to about 800 people in the communities every Sunday with a detailed calendar of what's happening. So we've been doing more online educational programs. And we just had the board of directors just had a work day last Saturday to do our 3-year plan to see what our focus is on for the next 3 to 5 years. And so we're working on getting those goals more focused at this point. But everything's going well. We got a physical space, a room that's about maybe about 7 by 15 in the city building. And so we have our, as Martha and I will call our national headquarters.
Congratulations.
Yeah, yeah, yeah. So,
Kathy.
thank you.
Good. How about Rebecca up in South Burlington?
Hi. So we're doing well. We are doing in-person lunches twice a week. Can you hear me?
Yeah,
Just making
I can hear you.
bingo going on in the next room. So, we have in-person hot sit-down lunches on Wednesdays and Fridays, and we have a variety of activities going on. Anything from bingo to bone builders to Tai Chi. We're doing some crafting events. And yoga. So we're pretty much up and running, and we have a full calendar. And we've been going to the Age Well. Age Well up here has some special luncheons that we've been going to. But yeah, we're up and running and we're busy.
Good. That's a good report.
Yep.
How about Susan in Chelsea, or I don't know where you are today, Susan, but whichever site you're from.
We're doing okay at all 3 sites. We have been really pushing on fundraising. We're actually in Chelsea, we're selling wreaths. Last year we did that just curbside, and we sold over 50 of them. So we're hoping to do a little bit more than that this year. And the other thing we're concentrating on is the rest area fundraising, and that's been going well too. Everybody's staying safe, wearing masks, wearing gloves. Everything's individually wrapped. As far as the sites being open, we're open 1 day a week at this point per site. 2 of my sites are doing good. They're doing 8 to 10 people a time. But one of my sites, I'm lucky to get 1 or 2 people. So I don't know what's going on with that. But Meals on Wheels is really still busy, and so is curbside.
Good. Thank you, Susan.
You're welcome.
I want to make sure I'm not missing folks here. Megan, I don't think we've heard from Megan yet in Fairfield.
Yeah, hi everyone. So an update for us. So I'm with the Fairfield Community Center. So we have a senior meal distribution that happens once a week. This is still going pretty strong. We are having an issue with volunteer burnout. Some of our volunteers have been sick the last few weeks, so it's been hard to get people to actually come in and work for the meals. But we're still doing those through Everyone Eats as a take and heat meal. And we display other items that's donated from Hannaford, kind of connected to our food shelf, so people can get really, some seniors come and that's their entire food shopping for the whole week, is everything that they get through here. We are continuing going through Everyone Eats until the end of December, I believe. After that, we still do need to find more funding, which is a little bit of a concern. We've recently had to change caterers. It seems like we're changing caterers an awful lot lately. And I was kind of hoping to, because we're not planning on doing congregate meals for quite a while. It seems like that's just not on the cards for us to start up anytime soon. I was kind of hoping for more ideas of things to do to keep seniors in the area active and still where they can socialize, but in a safe way, which it's hard to tell right now. We have started doing some things like yoga, which is open to all ages, not just seniors. And it's just, I think it was Melinda was saying earlier, I think we're having a lot of the same issues with just engagement, reaching everyone that we can, and also trying to come up with these activities that are going to be appealing. So yeah, it's been a little rough the last couple of weeks, to be honest, but we're pulling through there.
Good. You know, I'm hearing from colleagues and a couple that aren't on this call even, but at other senior centers, it is, people are feeling really burned out, and you know, my heart goes out to you. I am too. It feels like sort of a time where we're all getting a little exhausted, and keeping people safe and engaged and knowing how to do this for such a long extended period of time. I think for us, some things that are at least helpful, here, and if you have any grant money that you can apply for or find, one way that we really upgraded our technology and ability to connect with people at home and keep our numbers smaller in the building, so we're not having so many people in the room. We bought an owl, which I know some of you have heard me talk about on other calls, but from Owl Labs, it was $849, but it's a 360 camera and speaker, so that you just leave it connected to a laptop, connect to a Zoom, and then anyone in the room the microphone and the camera turns to the person who's talking. So we've been able to use it for instructors and for classes, and then the people on the computer see whoever's talking, and it just takes away all the burden of technology. So that's one way we're connecting people at home and in person, and we're doing pretty much everything. We offer everything that we do hybrid pretty much. And then we really just go with themes like for Veterans Day, right now we have a poppy painting project, and they're copying some Georgia O'Keeffe paintings. So we partner with a local art group to do those kind of classes. I saw on Facebook that Wendy, our AAA nutrition director, paints beautiful mandalas with dot painting. And so of course we've nabbed her to come do one. I think we're scheduling out into January, but I think we just try anything and everything we can, but any theme, like it's soup month, so we're going to do soups, and do a cooking class on soups because it's soup month, whenever that is. But that's what we're doing here.
Deanna, when you talk about themes, last month, there was a day that was National Coffee Day.
Yeah.
I kind of have a bigger area, but I hooked up with a local coffee company, just a local company, who came and did a wonderful presentation about how they make their coffee, where the coffee comes from, and about coffee itself. And then they did like a coffee tasting, and that was really successful. I mean, I had like 6 or 7 people come, but people were really interested in that.
I love that idea. I love coffee.
I mean, I know you guys, some of you are smaller than I am, obviously, but that might be something, even just because I did it around National Coffee Day doesn't mean that you couldn't do it around another time either.
Yeah. I love that. I need coffee right now. Okay, Maddie in Montpelier.
Hello. Let's see, what do we got going on here? I don't know, it's open 5 days a week. We have about 30-ish classes running. Most of them are hybrid, but some of them are over Zoom, but some of them are in person. I learned yesterday that we harvested like 5,000 pounds of produce from our own. We have our own farm that the city helps us run. So we harvested food that will be used in our Meals on Wheels program. We do weekly frozen delivery for our SAC members, and then twice weekly curbside pickup, but no congregate meals. We just hired a new kitchen manager who will start in a couple of weeks. So hopefully soon, because right now we're using the community action capstone and berry. So we hope to be cooking meals ourselves, and we're getting our kitchen ready and buying a bunch of new stuff for that. And then we hope to go back to daily hot meal delivery in January, I think. December or January, but we'll see what happens because some of our members actually really like the weekly frozen delivery. I myself I'm the aging in place coordinator, so I'm tasked with expanding the at-home program we're trying to start, which is helping our members age in place. So I've been doing a lot of home-based outdoor and indoor tours. We're trying to think of new socialization programs to reduce social isolation, which is hard with the Delta variant happening right now. Yeah, it's gone pretty well though, I think.
Awesome.
Yeah.
How about Joanne in Castleton?
Hi, everybody. I think our biggest challenge here in Castleton is restricting the number of people who can come. We have about 400 members and they just all want to be here immediately. We did start senior meals October 4th. We do it 2 days a week, but our meals are prepared by a caterer. So we only serve the meals here in our dining room. We don't have to prepare them. During the summer, we were doing picnics on the lawn, and we had anywhere from 70 to 90 people coming outdoors, which was easy to do because they could spread out on the back lawn. We have a couple acres here. But then when we came inside in October, we just said, how are we going to do this? So we found out that we could safely space people if we limited it to 30 people in our dining room. And so when people make their reservations, we say, if you're one of the first 30 people, you can eat inside. Otherwise, it's grab and go. So actually, we have our first one of those coming up next week. And we have 50 people signed up. So 30 people will be able to come inside. The other ones will have to be grab and go. Our transportation program has been up and running for quite a while. We have our own van service and a full-time bus driver. And that's been a big help for people to be able to get to doctor's appointments during the COVID crisis and so forth. In our wellness program, again, we have really a challenge in terms of limiting it because we've got Tai Chi and yoga, bone builders, better balance, and all of these classes. But so far, we've been able to spread out in our barn, which is our wellness center, and keep those folks safe. But we keep having members come up and say, I'd like to do something. Tomorrow, we have a member who's going to do a secret sketch party, which I guess is something that's online. I had never heard of it before. But there's a group of 7 or 8 people that are coming and they'll do this online video and do sketching. And another one program is being run by an intern from Castleton University who's here for the fall semester. And she's doing a Zentangle workshop, which I learned about from our online programming during COVID. And she's doing the second one next week. So it's just all kinds of things going on, but it's just so much work to try to say, okay, how can we do this and keep people safe? And we can't have too many. And how do you turn them away? You know, I mean, we've got a birthday luncheon coming up. We have to turn people away who have a birthday. It's just awful, you know, not to be able to have as many as you want in the room. That's our biggest challenge, really, is just limiting the number of people to keep them safe.
Absolutely. That's so hard. We have that happening with Veterans Day right now, which we really tried to make sure all our veterans got signed up first, but we're limiting the indoor participants to 65 and then having the rest be grab and go. So it's really difficult to turn people away, as you say, especially for things like veterans meals and birthday days.
What we did do for the birthday this month, which helped a little bit, is that a week before our newsletter came out, which announced the birthday lunch. A week before that, we sent an invitation to each of the people that we have in our system that have birthdays that month and said, you know, we're going to have a birthday lunch and you're getting an advance notice. So if you want to get in, hurry up and call now. And I would say 90% of them did get in. They're among the first that will be able to be seated, but there were a couple that didn't call right away and they're on the wait list or they'll have to have their grab and go meal.
Yeah. Good job, Joanne. That's awesome. Marianne in Northfield.
Hi, we've just come off of a 2-week closure. Our cook got COVID, and so she had to quarantine and everything. And so we closed down, we did our Meals on Wheels, and again, I did the cooking for the last 2 weeks, and to keep everybody safe and everything, so we closed the building and had nothing going on. We're trying again to open back up and have things, and we have iris paper folding on Friday, which is done by one of our trustees, is a crafter and does this program. We have a couple other things that are coming up, but I'm so afraid, you know, of the COVID coming back again and everything. All people that were in the building when were in the kitchen with the cook at that time all came back negative. And she had all of us have had our shots and everything. So she didn't understand how come she came down with it, but she did anyway. a very mild case, I'll say, that I guess when you have your shots, you don't get a very bad case. It's like a headache and sniffles and all that kind of stuff. A little few aches and pains and being tired. And she did lose her sense of taste. So, but she's back now and everything's fine. And we're trying to move on. And that's where we're at this time.
Good. I'm glad the rest didn't get it. That's a blessing.
Yep, nobody got it.
Good. Mark, I just realized I didn't really ask you for an update. I'm sorry about that.
Oh, you don't need to apologize. I've enjoyed listening to everyone. Things here are going well. We're continuing to follow CDC recommendations, which don't have any capacity restrictions for vaccinated people. Unfortunately, we've got pretty much universal vaccination among our participants. We are still requiring masks and we're being a little bit more careful with public events, but so far so good. You know, things could change at a moment's notice, but we've got our contingency plans in place and everyone's doing well. Just launched our new website, so that's actually had the unintended effect of making more work for us because it made it easier for people to ask us about stuff, and they sure are. We've been getting all kinds of new calls and emails that we weren't before as a result, so that's encouraging. December, we usually do a bazaar, but we decided that's way too much work for what it's worth. Like, we'd probably be paying our activity coordinator the same amount of money to organize it as we would be taking it in. So we decided we're going to do a craft fair. And so we've been soliciting local crafters and vendors who make products in the area to buy tables, and so far so good. We're probably going to have more people than we have space for that are interested, so that's good. We've been working with the town on improving energy efficiency in the building as part of the town of Hartford's really ambitious climate mitigation goals. The building is owned by the town, so it's nice because it's up to them to find funding for it. So we'll be switching over all of our heating and cooling to heat pumps, hopefully any day now. There's still some electrical work that needs to be done. Let's see, we're having some challenges getting people to come back on the van. So our transportation numbers, while our congregate numbers are really, they're not quite where they were pre-pandemic, but they're getting closer and closer. The transportation numbers are not. So that kind of remains a challenge for us to figure out how to better utilize this awesome service that we have. And I guess the last thing I was hoping, I mean, we're running short on time, but I'm a little concerned about takeout meals. I was talking with Wendy, and it sounds like Senior Solutions will no longer reimburse takeout meals or grab and goes if we're offering congregate lunch. We do have a number of people that still use them, and if we do, the numbers in Windsor County for COVID have kind of leveled off, but if it spikes again in the winter time, we'll probably restrict capacity a bit more, and in which case I don't know. I mean, I don't think we can offer takeout meals if we're not getting any reimbursement from the AAA. So I was hoping to find out maybe what other sites in our region are doing, or maybe other ways that other AAAs have found ways around that. So other than that, all's well.
Can I interrupt to see if Connor's still on, and we can ask him if we might be able to use some of the American Relief funding to pay for to-go meals? Do you think that's, we don't know if we need to follow the OAA guidelines for the relief funds or not?
Oh, no, yeah, we're allowing takeout meals to be reimbursed first. Yes. So that's something we can talk about offline if you want to get some just technical assistance on, but yes.
Wait, so we're still allowed to do to-go meals and congregate meals at the same time?
Yes, yeah, to-go meals are allowed.
No,
that's not what.
Actually, what Mary Woodruff suggested to the AAA directors was that we can fund them if they complement each other, that if there's a sit-down meal at a congregate site, we wouldn't also have a curbside pickup that same meal or
Okay.
time.
Right.
So
So,
like
yeah,
if
let's
it was
get-
Tuesday and Wednesday were sit downs, maybe Thursday and Friday could be curbside pickup. That
Okay.
was the discussion, I think, but I also understand that each agency has discretionary decision-making about those other funds. Is that right, Connor?
Yes.
Yeah.
Yep. So yeah,
Okay,
let's
good.
let's get, because of where things are with Delta, and we want to make sure that seniors in the communities are not forced into doing something that they're uncomfortable doing in order to get that meal. And what I mean to be forced into going to a congregate site to get that meal, we'll just want to make sure that the choice is available. And so maybe we revisit that conversation a little bit more as we tease out the details and get more information from the sites about where they stand with their participant levels and comfort levels. So
Good. Thank you.
Yeah.
I mean, I am just really hearing about it. So my concern, I mean, we offer congregate meals 5 days a week, but we have some people that are really not comfortable coming back in the building and being seated in, groups, and are not coming in for dining, but we're still, every day that we're offering congregate meals, we're still doing up to 20 and even more takeout meals every day. So we would not be able to offer those if there wasn't any type of funding to help offset that cost.
I
Good.
guess
So-
I'm just a little confused. So like, should we stop offering takeout meals now because, or should we continue until further notice, or what?
Connor, can you answer that? I mean, it was my understanding that we could not do congregate and takeout on the same day. We could, we could have takeout if we weren't doing congregate. So I don't want to misinform
yeah,
my
I don't want to
sites.
make a decision, or Mark, I'm gonna get in touch immediately with Mary and reconfirm everything that was talked about. So just I'm sorry, just for right now in this immediate, put you on standby, but we'll get back to you by the end of today with what you should do.
Okay, yeah, I think it's worth pointing out, like, as Deanna's situation, like alternating between takeout days and congregate days, like at least in our community, is, it doesn't really make sense with where the virus is right now, because we can still have congregate meals safely, particularly for people that don't have, underlying conditions. So I don't know, it makes more sense for us to run them at the same time. So I just want to make sure that that part is heard, and it isn't assumed that most people are alternating, but that's not a thing.
Melinda has her hand up too.
Yeah, so what I was doing, because we have a meal site 3 days a week. And so like I have a couple people that would take a couple meals on the day of the congregate meal for the days that we're not open, which is what we would do for our Meals on Wheels people when we're closed. I mean, they get, like on Tuesdays, they'll get 1 hot meal and 2 frozen for Wednesday and Thursday when we're closed. So I don't see how that's any different for somebody that's congregate. I mean, they're still not, I mean, they're not completely homebound, but a couple of people that come to congregate are pretty close to homebound.
Great. So you, Connor, will get back, you're going to follow up as a team and get back to us, or have the AAAs get back to us.
Yeah, exactly.
Kathy,
Yep.
you're
We'll make a
muted.
decision on this.
Kathy and Rob are muted, but are waving at us.
Yeah, thank you. We are going to be open for Thanksgiving, and we're trying to, let people know that it's all takeout. We don't, we're not going to have we don't have any congregates. We're still closed. The dining room's closed. So we're asking for a donation of $10, but if somebody can't afford anything, we're just going to give them the meal. So it depends on what people's, whatever. I'm all excited here because I'm baking bread and I'm trying to talk here. And I thought we were going to shut down before I had a chance to say anything. And we offer soup all the time. So with Soup Month, we're there already. I mean, that comes with our regular meal. Plus it's corn chowder on Thanksgiving, along with a full meal, plus apple pie and pumpkin pie. So, and we have a number posted. If anybody, just have to let us know as soon as you can, and we'll have meals ready for them. So that's it. Otherwise, we're doing well. We're not going to open up the dining room, except that we will make the dining room available if anybody wants to use it on the days that we have meals. So it's at their discretion and their responsibility. We'll make it look nice and stuff, but they can come and sit if they had to, because there's a few people that want to just sit and maybe see each other or something, but
Yeah.
and eat their takeout meals. But that's it. We can pass it on. You go. Bye. Thank you. Thank you very much.
Thank you all. We're, I think, losing folks that have to go pick up children and other things, and I have to as well. But I really appreciate all the updates, and we will have the follow-up on the grab and go and takeout meals. If there's any other questions that come up, please feel free to email the group in mid-month. The most up-to-date group list is the last one that I sent the reminder out on. So please stay in touch, and thank you, Connor, and all the AAAs for getting the follow-up for us on the grab and go meals. And Mark, thanks for bringing that up. Thanks, everyone.
Bye, everybody.
Thank you,
Bye.
Nina.
Bye.
Yep.